Okay, hi, I'm Dr. Thomas Wright, and I'm going to be talking on kind of a related topic, or the same kind of talk on the safety with liposuction as well. And I also, want to definitely thank all the people all the hard work that went to putting this this amazing conference together, and want to thank the organizers and all the people that help make this happen. So, okay, I have no financial disclosures, and so the thoughts began for this talk when in last fall, when Dr. Adam Ali published a case called Fat Attacks in the British Medical Journal, and it's about fat embolism occurred after a liposuction in the patient. It was a patient who had lipedema who was having liposuction of her knees and lower legs. So fat embolism is when, under some traumatic event, not rarely with liposuction, more commonly seen after like a car accident or such, the fat goes into the veins and embolizes to the lungs, and this is a serious and potentially life-threatening kind of event. So afterwards, I began corresponding with Dr. Ali to find out more, and there were risk factors involved in this patient and around the surgery that I think could have been mitigated, and who knows, maybe this could have been prevented. So what I'm going to do is I'm going to review the medical literature on that speaks to risks for liposuction and risk for patients with lipedema, specifically in liposuction, and how we can reduce them preoperatively, during the procedure, and postoperatively. So the risks for liposuction with, for any patient having liposuction, but lipedema patients generally have higher risks because of comorbidities they have, and so talk a little bit about that, the risk factors that increase complications with liposuction. So lipedema patients are generally heavier than most patients having liposuction, and increased weight or high BMI is a risk factor for any surgery, and including liposuction. And lipedema patients also have larger than average subcutaneous fat, and the risk of complications from liposuction increases significantly, about a threefold increase once you remove above 5 liters of fat in a single procedure. Use of general anesthesia increases the risk of complications with all surgeries, including liposuction. General anesthesia itself can cause life-threatening complications, and general anesthesia can, especially repeated general anesthesia, can increase the risk of postoperative cognitive dysfunction. Now, and that's really seen most in on the very young and very old. Presence of varicose veins increase the risk of bleeding, increase the risk of DVT and embolism. And so lipedema patients have increased risk for varicose veins and venous insufficiency. The larger the diameter of the suction cannula, the more traumatic. So I just want to spend a second here explaining. So here these are tumescent. These are the cannulas we use to introduce the tumescent. And this is a wall tumescent cannula, and this is the sort of standard Klein tumescent. They both administer the tumescent under pressure. The wall is under higher pressure, But the tumescent cannulas are not themselves do not cause trauma. The trauma occurs with the suction. So and the So how much did you guys miss? Okay, all right. So again, the suction cannulas are the ones that the studies have shown are associated with trauma. So on the left is this is a PAL Mercedes cannula. It's a small 3 millimeter cannula, and it is the least traumatic. And then these are 2 wall cannulas, and they're slightly larger in diameter, and then they have different openings. And the more aggressive openings, like kind of look like more like a cheese grater, are more traumatic. And then this is and then on the far right is the this is a Blugerman cannula, and it really does look like a cheese grater, and it's a larger diameter cannula. And so this is really what these suction cannulas are, what are the business end, so to speak, of the liposuction. So mitigating or reducing the risk of complications. Before liposuction is performed, complete decongestion of the tissue should be done. You know, that's the whole manual lymph drainage, the compression, wraps, and pumps possibly necessary. It's not only important to reduce swelling and improve symptoms, it also reduces inflammation, tenderness, and heaviness. And I think it's important to do before the surgery so that people can realize the benefits of the compression, and it also helps with that they, in an immediate post-operative procedure, that they're not trying to also learn how to manage the fluid, and inevitably the fluid gets worse, at least for a short term after the liposuction. So patients with varicose veins and venous reflux should be treated. Certainly significant varicose veins and reflux. Not every patient with a varicose vein or a whiff of venous reflux on an ultrasound needs to be treated. But large varicose veins increase the risk of bleeding increase the risk of DVT and embolism. Now, smaller networks of spider veins, what we call, are that's somewhat controversial. I do see increased spider veins in lipedema patients, and some of them, if there's a very rich network of them, and I feel like it's important to treat them because if they're not, I'm afraid of excess bleeding. So, and as we already mentioned, lipedema patients are more prone to those. So, I firmly believe, and I know this is that reliance on generous two-minute anesthesia is important. It helps protect the lymphatic structures, and if you rely on good tumescent for pain control, you know that you're going to get immediate feedback, and you're going to know you're going to have comprehensive. Now, some people, some surgeons do use general anesthesia for liposuction, and I think that's there is some increased risk with general anesthesia, as Dr. Amron stated. He quoted 7 in 10,000. Probably with modern techniques, it's probably as low as 3 in 10,000, but but there's definite good studies that this does add the risk. So limits the amount of fat. So once there's a fair number of studies on once 5 liters of fat is removed in one surgery, the risk of complications goes up by about 3 times. And in some states like Florida and California, they recommend that you stay overnight if you're going to go over those limits. Now, with a lipedema patient, you know, who are very, there's another way of looking at things, and that's by total body surface area. And so if you use the guidelines for 5 to 8%, you could probably remove, that would probably, on someone who's very large, maybe you might inch up to 6 or 7 liters of fat. But again, there is limits to how much fat can be safely removed in one surgery. Again, this is back to the cannulas, and so again, the delivery of the tumescence does not cause trauma or prevent trauma. It's really it really is just the size. Now, size goes 2 ways. You can remove fat faster with larger cannulas, but they have an increased risk of trauma, and smaller cannulas, they are less likely to cause trauma, and but take longer to remove. And there's the studies on that. And then finally, you know, knowledge of the lymphatic location. So, I mean, the most important structures in liposuction, subcutaneous liposuction, are the lymph collecting ducts. And okay, and so here, if you can see, they run along the fascia just above the muscles, and in the a pseudofascia around the saphenous and vein, etc. And they, if you injure those, you're more likely to get a seroma, or likely to have increased swelling post-operatively. And so care must be taken to not direct the cannulas against those structures. So that's my talk. Medical literature does give us useful guidance on how to reduce complications from liposuction on lipedema patients. And while liposuction is generally safe, great care should be taken to reduce any risk of outcomes when possible. And these are the studies I reference during my talk. And this is our contact information, and we also have a booth out front, and thank you very much.